I've been to many dental operations and tooth extractions now with many of my clients. I've never actually experienced one myself. And I know, the best way to empathise with all my clients is to experience it myself. Having a wisdom tooth unexpectedly come down and it didn't actually surface completely, I thought, well, this is an opportunity to use hypnosis for myself, and I don't think I would have had it any other way.
You are going to do all your own self-hypnosis induction, meaning I surf your ride.
Don't tell me what you're doing or how,
No.
but if you say to me, let go of the tooth.
No, that's taken for granted. I will do
Okay,
that.
just say, okay, let it go.
Basically, when we take it out, I don't want just enough blood to form a blood clot. I actually want enough blood to flush it.
Oh, okay.
Okay?
Alright.
And then I'm going to say to you, okay, it's flushing, keep the flow going, as it were. Now you can stop at a point, right? And then we'll wait until it effectively forms what I call the gel plug, like a jelly plug.
Yeah.
It's like a jelly plug.
Yeah, and I've seen it on patients.
So I'm sure.
Yeah.
So, and then of course I've got to put that little stitch in. And if all goes well, you'll only need one stitch.
Michael was brilliant because he's worked with me on a number of occasions, and he's also an advocate of using hypnosis for tooth work. He's done many surgeries and things without anaesthetic himself. And he allowed me the chance to kind of lead into the sensations by using a probe to begin with. And when he was using this particular probe initially, he continuously used it. Apparently he was going harder and harder with it, and it was exactly the same sensation as the first time he put it in the mouth, which was a lighter probe. And he said at number 9 it would have normally been caused, most people would have jumped out of the chair, and he knew I was absolutely ready.
Doing good. You're all right up to this point? That's good. So the next little story is we're going to do the ultrasonic cleaning bit that goes directly underneath the gum. There is water accompanying it, so we will have to have some suction going. Okay. So you're right. We're going to now make our little first primary incision. Okay, so yeah, that's it. As you're taking yourself down lower and lower, right? And are you ready? Here we go. So I'd like you to put your head up and back like that a little bit. Yeah, that's good. And to turn slightly towards Irene. That's good. Okay. So you come across me this way. Yeah. So, yeah.
Surprisingly, the easy part was contending with the sensations. I didn't feel anything. I mean, I literally did not get involved with any of what would be considered painful experiences or painful sensations, which looks really weird because the thing that really got me that wasn't easy was the pressure.
Now we're just going to elevate this up out of here. There's just going to be a little bit of pressure pulling this out of the way.
It was so unexpected. Michael, the dentist, Michael White, had said to me, you're going to feel pressure. And he really tried to emphasize how much pressure I was going to feel, but nothing could have prepared me for this pressure. Nothing. The actual cutting of the gum, the moving of the tooth, all of those things, they were not what I would consider what would normally be considered as painful. They just didn't feel painful. I was so surprised.
It's a lot of pressure because I have to just get it to leave it. Yeah. Would you like me to put the anesthesia?
No, it's not hurting.
It's just a question of getting at it because of the little angle leaning into the tooth. I've just got to get around that angle. Once I've got in under the angle, then I'll be fine.
I've seen other patients working through the pressure experience, and I've been there holding their hand or scanning their body, and in many cases just using touch on the body, touch on the leg or on the stomach, just to give them that kind of reassurance. And actually I noticed with myself, I really wanted that. I really noticed, I really wish there was a me next to me. And I just thought, this could be great if I kind of put my hand up for the nurse, and I knew I didn't want to grab it or it wasn't to hold tight. If you notice on the film, I put my hand up. It's actually very floppy, and it was just to have that sense of, oh, okay, I'm okay, I'm back. It's sort of like coming out of one's body and then coming back into it and saying, yes, I'm grounded again. I can see how having either the nurse be involved in that experience or a hypnotist be involved in the experience can make a big difference.
It's coming, it's out, it's out. Here we are, it's done, my dear, it's done. Okay, now, just give me the forceps, I'm just using a pure forceps to just take it out. It's out, it's easy for me to get it this way, okay? Well done. Water into there. Okay, so here we go. Just let it flow, that's fine. I have to tell you the good news is, remember I told you about the little flap? It almost perfectly closes it down. It's incredible. Look, it looks neat, I tell you. Okay, so now we're going to just put the suture in. Thank you very much. Quite difficult because this is the area, so I'm sorry, Sharon, I've got to pull your cheek out just so I can see properly.
In terms of pain, zero. Even putting the stitching, which is actually my fear, was like putting tooth floss.
Right.
So that even didn't, I was like, oh, it's just like flossing your teeth.
That's much better, with much finer control. That's better, that's fine. That's it. And everything's looking just super duper fine. And now what you can do perfectly is to stop that blood flow completely, just there for the meantime. Yes, just stop the blood flow. Only in that area, stop the flow. Anyway, the good news, it's all out in one intact piece.
Thank you.
The second good piece of news is that the maxillary tuberosity around the back there is quite fine bone. It's clean, absolutely clean. So you're right like that.
You're the right guy to do this kind of job.
So there you go. See, completely clear, nice little flap all closed over there. And of course, see the cheek, no bleeding, no nothing. And that's all up to you. You've done it all. Well done.
Thank you so much. I feel really relaxed. I'm really glad that I'm able to stop the blood. You might notice I put my hand up at one point to say stop, first stop the bleeding, and because Michael has said you need to stop it now, and I just went to myself again, stop, and it stopped. And I'm really pleased I have that ability. I've got to it at 7 o'clock, so in about 5 or 6 hours, I've got to then start to let open the capillaries and let the blood flow change again. Knowing that I can do that is lovely, to have some sense of control over one's own body and senses, because it's not just for this moment. I mean, it's for anything and everything in my life. It's a proof to recognise that mind over matter is completely possible on every level.